We're joined today by Logan Yelderman, Assistant Professor of Psychology and Social Psychologist at Prairie View A&M University. Dr. Yelderman is joining us today because of his recent work, his recent research that was published in May of 2019 on mass shootings. Dr. Yelderman, thank you for joining us today.
Thank you for having me.
So, Dr. Yelderman, tell us about your research on mass shooting.
Okay. So we did a little bit recently where we looked at news reports on mass shootings. And some of this data came from online news reports, media reports, and sometimes republished or presented police reports, things like that. And a lot of this information was gathered by Mother Jones, which is a news reporting agency. So we used some of their data, and then we combined it with some of the data that we collected, reading either the same or even more news reports to try to gather kind of what information is available to the public on these mass shooters and these mass shooting incidents. So our research is strictly on people who had already perpetrated mass shootings. We did not look at what might predict mass shootings, just looked at variations in violence and other factors among already perpetrated mass shootings.
Thank you. I think it's important to note that. What are some of the major findings of your research?
So some of the major findings that we kind of came across was in reported mass shootings, we found that kind of two sets of findings, one dealing with kind of health and mental health and one dealing with weapons. And so the first one was that we found compared to mass shooters that did not have any type of mental illness, diagnosis, or any history or any signs or symptoms of mental illness, at least reported in the news, compared to those individuals, those with a diagnosed mental illness, which we used diagnoses from psychologists, psychiatrists, or confirmed diagnoses from close people like family members, things like that. There was no difference in violence. And so we define violence by the total number of victims in the mass shooting incident. So compared to people without any kind of mental health history, those with a diagnosed mental health issue or illness, there was no difference between those two groups. However, where we found a slight difference was those who did not have a formally diagnosed mental illness, but were reported as having some sort of signs or potential symptoms of mental illness that were undiagnosed, maybe even unrecognized up until the report came out. There was a slight increase in the likelihood of increased violence with that group compared to those without any mental health history, without any kind of mental illness. So in other words, one way to kind of think about it is there was an increased likelihood of violence for those with an undiagnosed mental illness or mental health condition compared to those without one. And then the second kind of grouping of findings was with weapons. We found that the more weapons brought to the mass shooting by the perpetrator, the more victims in the mass shooting. And that's probably because more weapons a lot of times meant maybe more accessibility, more capacity, and maybe even motivation and intention for targeting more people. The other one was we saw some differences in weapon type as well, and we saw some variation in location. And so those are kind of the major findings that we found and reported in our study. And again, this all comes from the news reports, and so the information we had available to us was made available through these reports.
That's very interesting to note, and based on your research, just to recap, a person may have a mental illness, but they may or may not have been diagnosed. And your findings indicate that those who, based on other reports, may have had an undiagnosed mental illness, those mass shootings seem to be more violent or more heinous. Is that correct?
Yes, and there's kind of two ways to interpret that. One is that there's some aspect of the mental condition that plays a role. But another one is if there's not a confirmed diagnosis, that the more violent mass shootings, the media does maybe puts forth a harder and higher effort to try to find some background on mental health, because that is a current part of the debate. So it may not be that mental health is actually increasing violence among mass shooters. It could very well be that mental health is kind of an answer sought out in the more violent mass shootings. So it's difficult to really understand why that might be the case. There's a lot more research that needs to be done to really find out why that's the case. But that is kind of what we found.
Well, Dr. Yelderman, I'd like to get your thoughts on this. There are several news stations and politicians and pundits that are making the case that violent video games have a place in the mass shootings. What are your thoughts on that?
So, yeah, it's a good question. There's probably a lot of people out there who can better answer that question. So it's not really what we looked at, but I'd say that link between violent video games and mass shootings, particularly in gun violence more generally, is not extremely clear, and it's seen and it's also kind of suggested to be direct. But I'm not sure that case can be made at this point with the research that's out there. If there's any effect, a lot of the current research and some of the larger studies that have looked at a lot of different studies on this topic suggest that if there isn't a relationship, it's pretty small. But again, we haven't done that research in our lab, so I'm only reporting what I've read in the field from others, and so others would have a better answer for that.
Thank you. So, Dr. Yelderman, as we bring this interview to an end, what, based on your research, would you like to share with the public in light of the increase in frequency of mass shootings here in the United States?
Yeah, so one of the biggest kind of questions and takeaways we're posed with this research is, can we suggest an answer or fix to mass shootings to try to prevent them from our research? Our research doesn't look at preventing mass shootings, and so we can't really use our research to make that type of determination. But I will say that when looking at mass shooting violence, whether you're looking at variations among mass shooters or looking at what might predict mass shootings, it's probably too heavy of a burden to place solely on law enforcement, to place solely on mental health professionals, and even to place solely on policy makers. It's something, and this is gun violence in general too, along with mass shootings, but it's something that has to be addressed, I think, at the societal level in terms of social accountability and social responsibility. So we kind of as a society have to understand that these behaviors are a result of how we interact with one another. And so it really is going to be kind of on a society at the individual level, family level, friends, neighborhoods, communities, and kind of just interpersonally to really hold each other accountable, be involved in each other's lives, and be responsible for yourself, but also for each other. And so I think that's really one of the takeaways that we can suggest might be a positive and beneficial direction to take, rather than thinking one policy is going to fix it, mental health professionals are going to fix it, or law enforcement is going to fix it. But I think it has to be tackled from the ground up, starting with just how we relate to one another and how we interact with one another.
Thank you so much. And again, we're joined today by Dr. Logan Yelderman, Assistant Professor of Psychology and Social Psychologist at Prairie View A&M University. Thank you.
Thank you.